Have you been told that 85% of back pain is nonspecific? Further, have you been told by your clinician or your coach or your provider, your practitioner, that you have nonspecific back pain? If you search back pain, people say that 85% of all back pain is nonspecific. Well, what are we talking about? What is back pain anyway? There's all these things we have to consider, and if you're not with the right clinician, they're not going to know how to test you and what to look for. In this video, I'm going to tackle the topic of so-called 85% of all back pain is nonspecific, and we're going to get very specific and help you navigate your back pain case. For those that don't know, my name is Brian Carroll. I live in Jacksonville, Florida. I'm a McGill Method certified provider, having power lifted for over 21 years and ending on a high note of being the first person to squat over 1,300 pounds. I now work with people all over the world from both a virtual standpoint and in person here in Jacksonville, Florida, with injury, resilience, and performance enhancement. I'm not giving you medical advice. For more information, go to PowerXStrength.com. Thank you so much. Enjoy this video. Before I get into today's topic, nonspecific back pain, I understand that back pain is complicated. I lived it. I understand the psychosocial and the psychological aspects and the detriments and the damage that one takes when their psyche, when their thing that they love the most, their baseball, their football, their powerlifting, their ability to navigate life without searing pain takes a toll on their mental space, on their mental capacity, on their mindset. I get all of that. Back pain is complicated, especially chronic back pain, something that's been lingering for months and years sometimes. Sometimes there's multiple layers of pain, which can cause a cascading impact on one's mental health and their perception of pain. Yes, some catastrophize their pain. I 100% agree. I see some people out there that stiffen and cause their pain when they're stressed out. They don't even know they're causing compression and flexion and extension and shearing and rotation and twisting and all these different things. Mechanisms on their spine that after a while it gets inflamed and it gets pissed off. They might not have a huge pathology on an MRI with a disc or facet or nerve that's being pinched. I get all of that. So let me preface this video with, I understand that back pain is multifactorial. It can be complicated. It's not always simple as there's the injury, there's the pain, now deal with it by removing the mechanical cause. I get that. Everyone that I see each week they don't have fresh back pain when they come to me. Some of these people have seen 20 clinicians and been in back pain for 30 plus years, still without a precise diagnosis, without proper treatment. Nonspecific back pain constitutes a significant 85% of all reported cases of lower back pain, quote unquote. I wholeheartedly disagree with this statement, and I'm going to tell you why. What exactly does this mean for those that have back pain? What is low back pain? Stu McGill, and I've used this analogy many times in these different videos. What is lower leg pain? Are we talking about bones, the tib and the fib? Are we talking about the gastroc and the soleus? Are we talking about nerves that innervate in there? Are we talking about patellar issues or knee issues when we're talking about lower leg pain? We have to be specific. Looking for the answer to your sleepless nights, sore muscles, and better overall well-being? If so, PowerX Strength CBD has you covered. All of our products are made of CBD isolate and have 0% THC, meaning there are no worries of failing a drug test or the worry of feeling high. With PowerX Strength CBD, we offer a wide range of products and payment options to ensure you have the option that best fits your needs. Don't just take it from me. All of our reviews and client testimonials on our site speak for themselves. You can even get 20% off your order by using code YT1306 at checkout. Go to PowerXStrengthCBD.com to order now so you can get back to sleeping, recovering, lifting, feeling, and being better. 85% of the people who have damaged backs have randomly damaged their back and have no cause or triggers of pain. Is this what you're telling me when you're quoting the 85% or nonspecific? I just don't buy it. I've seen too many people with back pain with direct correlation, one-to-one of imaging and assessment where you can see their pain. That does not mean that psychosocial factors can't influence pain, or others might have autoimmune disorders or inflammation patterns that make their back pain confusing, especially if they have something like an annular tear or dynamic disc bulge with annular tear. Depending on what they're doing, they might be great for weeks or months at a time, and then they have an episode where they're down and they have erratic pain in their toe and their leg and their glute and their back. On the other side, it can jump. That doesn't mean that it's non-specific. They need to have an assessment. Essentially, to me, this 85% number, again, I understand that back pain is complicated. I understand that some people have a hard time identifying the cause of pain. Some people might have psychosomatic pain. I can't argue what your experience is, but chances are you haven't had a thorough assessment. Essentially, what this number indicates is all healthcare providers struggle to identify a specific, identifiable cause of pain, even after thorough examinations. How long have these thorough examinations, how many minutes have they consisted of? How long during these thorough examinations has the doctor, patient spent time together? How long has a physical therapist or chiropractor spent or surgeon spent with this patient? Back pain can stem from an unlimited amount of issues. Bone, end-plate, endless types of disc pathology, special types of cruel herniations and tears and bulges, and combinations of all those three things too that end up causing facet and ligament injuries over time. We talk about the degenerative cascade. You lose a little bit of disc height or the disc gets soft. Maybe from bending over time, maybe from an injury where you lose a little bit of stability, and then the end plates start developing bone spurs or arthritis. You lose some disc height, then the facets posterior to that start to take more axial load. Then their articular cartilage pads start to grind together and become arthritic. Birth defects, car accidents, falls, postural imbalances, scoliosis, all these different things. By the way, I've dealt with scoliosis. I'm going to put up a picture of my spine directly from the front, and you can see how crooked my lumbar spine is. It doesn't mean that I had to treat it. Yes, it probably set me up for some imbalances, but I didn't need to go and try to make my spine perfect. Some people have things that need to be managed. I needed to manage that. Other people need to have surgery before they hit puberty with scoliosis and such. The human body is asymmetrical and not perfect, but when it becomes too much of a deviation, then we have to start addressing some of the causes, and they can be very, very ugly. Psychological factors such as stress, anxiety, finances can contribute to an overall sensation of pain in the lower back. I believe that. I was saying earlier about stiffening down and stressing. Most clinically depressed people sit leaned over, hunched down, don't want to make eye contact, don't want light in their field of vision, don't want people looking at them, and that itself is a very common mechanism of pain. Even if the disc isn't really bulging, it can cause inflammation and stress concentration. But I don't see people often with nonspecific pain. I find their triggers, whatever they may be. The prevalence of this 85% number raises important consideration, in my opinion. Does this 85% suggest that those individuals have not undergone a comprehensive assessment by a qualified practitioner? A detailed evaluation typically includes physical exams, patient history, potential imaging studies, MRs, CTs, all of which can reveal underlying conditions. But it doesn't stop there. Then you have to go and do postures, movements, and loads to try to replicate those pain generators. Then you can come to a better summary to understand. And it's not going to be 85% of these people are non-specific. Their back just hurts for no reason whatsoever. You have to have an assessment. In summary, while I do agree non-specific back pain is experienced, it underscores the necessity of proper evaluations, and you're not going to get this from your neurosurgeon or from your orthopedic or from your primary care or from your pain management specialist or your physical therapist or your chiropractor or your best friend on WebMD. You need an assessment from a professional. It underscores the necessity of proper medical evaluations to explore and address the various potential factors involved, ultimately guiding individuals toward effective pain management and relief strategies. We find what causes the pain, then what makes you feel better. Is it a tummy lie? Is it your feet elevated? Is it going for a walk? Is it some exercise? Is it some thoracic stretching? These are all the things that we do to identify, remove the cause, and help you give your life back. While back pain is multifaceted, multifactorial, and can be complicated, your doctor just telling you have non-specific back pain, which I hear every single day, I push back and I want to see their imaging. I want to spend time and ask them questions. If your practitioner is saying, oh, you have non-specific back pain, gotta get a better answer than you just have non-specific pain. I think there's going to be more to it than that.
Hope you enjoyed today's video. Remember, like, subscribe, share, click the notifications because we drop videos twice a week. We also have a live stream every Friday where I answer your questions. Click below to see the latest video that we uploaded. Also, for our products, our CBD, our books that correspond with these videos, it's down in the description. For more information about all things Brian Carroll and Power Act Strength, go to poweract-strength.com. You could book a consult both virtually and in person with me. Enjoy your week, and thank you so much.